I'm starting it out, and here is your question. Once you have read that, tell me, I'll move on.
Okay.
Yes, Dr. Bagi?
Yes, ma'am.
Yes. Okay, now.
23.35.
Yes, next.
No, ma'am. One
Okay.
second. Okay.
Yes.
Ma'am, can you tell me who is my consultant? It is not mentioned here.
It's me, Dr. Abdul Bagi.
Yeah, it's consultant Lad or
Sorry, ma'am.
consultant Bagi.
Calling to consultant Bagi and my
It says
consultant
call
is.
and inform trauma consultant. So that is consultant Bagi.
Okay, he is also my consultant. And I am what? SHO CT ST1
Your junior doctor on call. What does
junior
it
doctor.
say? Yes. doesn't mention here.
Okay, ma'am. Next.
Yes, that was it. That's the question. So once you're ready, I'll begin the timer.
Yes, I'm ready.
Okay, so if you have read and understood, considering with communication skills station, kindly begin.
Hello.
Hello? Yes?
Hello. Good evening, sir. I'm Dr. Jahan, junior doctor under you. I'm calling to update you about a patient. Can I confirm that I'm talking with Mr. Baghi?
Yes, doctor. I'm Dr. Abdul Bagi. Welcome.
Okay, sir. Can I summarize my case?
Please, would you summarize your case? Yes.
Okay, thank you for the opportunity. So, we have a patient of RTA, 20 year old boy, has open tibiofibular fracture, and his abdomen is distended. On examination, his GCS is 15, and he is unconscious. And on follow-up, he is hemodynamically stable, but we have saw that he in imaging there is a open right tibiofibular fracture in ultrasonography free fluid in paracolic bladder, and on examination there is a abrasion on the left flank. Abdomen is distended and tender. In the follow-up, our nurse has noticed that the patient has right-sided, extremely cold and pulseless limb. That's why I called you to update about this case.
Okay, doctor. What is the most urgent issue regarding your patient?
As the patient is have an open fracture, there may be a chance of acute vascular injury as the patient has cold and pulseless limb. So he may need urgent intervention.
So, why vascular injury takes a priority in this case?
There may be a chance, as it is an open fracture, there may be chance of vascular injury due to trauma, or spasm, compartment syndrome, or kinking of the vessels.
So, would you tell me more about the about the causes of pulseless foot? I mean, so what are the causes? Other causes?
Yes, compartment syndrome, spasm, kinking of the vessels, and trauma.
Okay, thank you. Is the patient wearing C collar? I mean, cervical collar?
I'm really sorry, Mr. Baghi. I don't have this information right now, but as soon as I'm off the phone, I'll check it and let you know.
Okay, you have mentioned he has an open fracture. Is he dehydrated? I mean, your patient?
Again, sir, my apologies. I don't have this information right now, and I will let you know after I check this.
So it's okay, it's okay. What is your plan for action for this patient?
Now, first of all, I would like to call orthopedic surgeon, orthopedic consultant, and vascular consultant. Then I want to do the immediate traction of the limb. Then I want to do a CT, abdomen, pelvis, and brain. And if patient allows me, then I want to do a trauma series X-ray of the um, spine, chest, and pelvis.
Okay, any other investigation you would like to order?
Yes, I want to order a full blood count, serum creatinine, ABG, and blood grouping cross matching. I want to give the patient, and yes, I want to do a duplex of the lower limb and CT angiogram of the lower limb.
Okay. So now, why you called me exactly?
Sir, I called you to update about this case as the patient might need a overnight surgery.
Okay. Ma'am, another question?
Yes. How will you fix the fracture?
Yes.
I will do the traction, the immediate reduction and immobilization for the temporary purpose.
What would you do for the wound debridement of the wound of this patient?
Yes, for the wound, I want to do the debridement of the necrotic tissue in the operation theater.
Okay, can you please tell me why did the general surgeon ask for ultrasound after
Yes, ma'am.
examining, even after examining that the abdomen was normal?
Yes, ma'am. There is an abrasion over the left flank, and now the abdomen is distended and tender. So
Yes.
they asked for a ultrasonography
To rule out what? Possible
to rule
splenic
out
injury.
any intra,
Possible splenic injury.
yes, possible splenic injury.
Okay. If you can tell me, what would you do before sending the patient to the operation theater?
Okay, I want to call OT in church, and I want to do intravenous line for the patient,
Yes.
and give the patient fluid,
Yes.
antibiotic,
Yes.
anti-ulcerant, and
Before antibiotic, you must add antibiotic according to the
yes,
NHS
I will give antibiotic to the trust
guideline.
Yes. protocol.
And
Yes,
analgesia and traction.
analgesia and traction. Yes,
Yes.
and of course, consent of the patient for the amputation.
Okay, can you please tell me why is it urgent? Or have you already told?
Yes, it is urgent because the patient has a open fracture and also already extremely cold and pulseless limb. So there may be chance of vascular injury on that leg.
Okay. Okay, would you who would you call during or before operation?
Orthopedic surgeon, vascular surgeon, OT in charge, anesthesiologist, general surgeon, plastic surgeon.
Vascular, did you count vascular? Anesthetic?
Yes, vascular.
Okay.
Anesthetic,
And
yes, I told.
operation theater as well. Okay, who would you
OT
get
in
involved?
church, yes.
Who else would you get involved in this patient?
A patient party, patient's relative.
Okay. Right. Why do you think the patient needs general surgeon's involvement?
Because if there are any intra-abdominal injuries happening or not, that's why we need general surgeon to do the open laparotomy.
Yes, there is
Emergency
more.
open
The
laparotomy.
wound, for the wound debridement, to rule out intra-abdominal injury, and for the compartment syndrome, to rule out abdominal compartment syndrome. Okay. So, right. Can you tell me how would you manage the free fluid in the abdomen?
Yes, in emergency laparotomy.
Yes. Okay. Why are you going to involve plastic surgeon in this case?
They will help with the decision what to do next about the open wound.
Okay. Right. So you've already told the information. So, right. How would you conclude this patient?
Okay, sir, is there anything you want to ask or you want to add?
In your plan? Yes. So you can
Anything, sir?
summarize. You can summarize the plan.
Okay, sir. So we have a patient of RTA, open tibial fracture, and now he's having coarse pulseless limb. We are thinking of it as an acute vascular injury. So we are now preparing the patient after consulting with you, the vascular surgeon and the orthopedic surgeon, for any urgent intervention or not. And I will let you check the C collar and the dehydration status of the patient, and I will update you about the patient.
Right. And then you will also do the CT, left limb angiogram.
Yes, duplex and CT angiogram of the
Yes, bedside
right
Doppler.
foot.
Yes.
Yes.
All right, good. Okay, thank you.
Thank you so much for your kind cooperation,
Thank
Dr.
you.
Bagi.
Yes.